Welcome to the Second Opinion Podcast. I'm Katie, and we've got Dr. Krishna Tewari over here.
AKA Chris.
Yeah, today on our episode or dose, we're going to be talking about some medical culture. I mean, as a nurse firsthand, I've seen a lot, and so has Dr. Tewari.
Sounds intense.
It is.
Wow. So, just out of curiosity, you being a nurse and your first day as being a nurse, like, I'm sure you must have gone through some trials and tribulations as, you know, someone like I have before, of course. So I'm just curious, like, give me some stories.
I mean, when you say first day as a nurse, like first day on the job, first day in school, like I could go through all of it, because first day of school, your professors and the students who are a year older that are your mentors, they're all like, this is going to be hell. Like from the get-go. It's not a very positive look.
And what was people's reaction to that?
Like the students, we were scared, like shitless. We were like, okay, here we go, day one. And all the professors are like, this is going to be not easy. This is going to be hard. You're going to see things. You're going to have to do things that you've never done before. And they really just try to scare you the whole time. Which, and honestly, you need to be a little bit. Because you do have to understand the reality of what you're signing up for and what you're about to be doing.
That's true.
Because there's a lot that I didn't think that nurses did, that they do, that even school didn't even teach me. So from day one, that's how it kind of started out. That's the culture of it. It's going to suck. It's going to be hard. You're going to hate it. So it doesn't really make you want to do it.
Were they saying that also, careful of doctors because they're cocky assholes?
Not from day one. Okay. Doctors aren't even brought up.
I know nurses have said that in class. Like their professors warn them from like doctors think they know everything and they're essentially
not
cocky
really
assholes.
Ours really focused on the nurses and focused on what they were going to do. Once we maybe got into clinicals, they were a little more focused on it. But I mean, even so, then let's go to day one of clinicals. You get a preceptor. They're usually not the happiest with their job. They usually aren't like, I love it here. I'm going to tell you everything about it. Let's get going. Like, that's never how it was. You'd get some preceptors that maybe had like a couple extra coffees that morning, and they were a little bit more like chipper. But all the preceptors I had were like, just whatever you do, don't do med surg, or whatever you do, just make sure you really think hard about which field you want to go into.
So as you accelerated, how did it work with the mentor and I guess the culture? Like what was your, I mean, you're coming from like college, right? So you're in nursing school, you know, it's a different profession because it's a medical profession. And obviously it's people see on TV how, you know, nurses, physicians, or just people within the medical arena are treated. What was your thought? Were you like intimidated? Were you kind of comparing it to like a soap opera or Grey's Anatomy or something?
Well, I mean, Grey's Anatomy, they just shit on nurses the whole time,
yeah, they
honestly.
Do.
And they make them seem like you're just barking orders at them, which is very real and does happen.
It does happen, yeah.
So that's realistic. But I guess Grey's Anatomy, if we're going to bring that up, I mean, the surgeons do everything, which is not the case. The surgeons do everything for surgery, of course, but like for care of the patient post-surgery.
They're doing like nursing care.
That's all nursing. Yeah, that's all nurses. And so
well,
when
I think they have to learn and train also how to like remove a Foley. And
maybe
put
once.
It in, you know?
Maybe once.
Yeah.
But then all the nurses do it.
I think doctors or people in training should see how to take care and do the whole shebang.
Oh, yeah. So then they know what we're doing.
Right. I mean, and it's still a pertinent and a very, you may not use it, but I think everyone should. I mean, I remember in medical school, we were drawing blood, learning how to draw blood and put in IVs and do a suture, which actually we suture, but
it makes sense that you have to learn all the basic type things too, because then you have to know what's a complication of this. What it could be causing this? Well, it could be because of their Foley or because of their IV, like the really basic things.
Yeah.
But from the get-go, I think I was very naive to what nurses do.
Huh. Did you ever get yelled at?
Oh, yeah. I mean, my professor...
So how does that?
My professor, probably the second to last semester that I had, basically told me, I don't think you should be doing this. And instead of like instilling confidence...
Did you
cry? I did. I cried.
Sure.
I cried in the hospital, like during clinicals.
In front of her when she said that?
Yeah, in front of her.
And what was her response?
She was cold. She was ice cold. She didn't shed a tear. She didn't even stutter.
I could see that being, am I in the right field, or questioning
Yeah.
yourself?
I mean, it makes you lose all confidence in what you're doing.
Yeah.
And like if you meet any nurse, they've usually always wanted to do it since they were like in high school or a kid.
Do you think it's a power trip, or you think it's because it's like a medical field and they're really trying to strengthen you?
I don't really know because whatever she was trying to do, well, now I'm like, suck it.
Well, now you're like, it's both, right?
Yeah.
Probably there is some power trip, but at the same time, it's like, look, turn me into who I am now. So
Yeah.
maybe there is some logic that it worked.
Maybe now looking back, it could have worked. But at the time, like it made me feel terrible and like what did I do all this for?
But do you think it's just the medical field, or you think it's like other, like if you go to law school or you go to some like other type of school and, people are like, you're not cut out for this? Or you think it's more common that we're treated like this in the medical field?
I feel like we could be treated like this just because it is people's lives. The stakes are so high that they have to be like this. Because like if you're not cut out for like a mean teacher or like
Right.
a mean patient, like you got to learn kind of early on. And they don't want to instill the trust if they don't see it
Yeah.
for you to go and take care of somebody.
So you did that, obviously made it through nursing school, and then I know you got your job at this level 1 trauma hospital.
Mm-hmm.
How was it when your first day with that?
It was like restart day one all over again. Everyone on the
Really?
unit's like, this is terrible. Like it was not positive. It was
I mean,
never
was it
positive.
isolated because of maybe the floor you're on, or was it like all your friends who also started experience very similar situations?
A lot of people definitely experience some things that were similar, some that weren't. Definitely, it varies personality. It varies on the unit, for sure. But a lot of them either had a preceptor that was eager to teach them
Mm-hmm.
because they needed more nurses and they wanted somebody to come in and have that eagerness and like
Right.
drive to want to do it. But then I got the short end of the stick, and it was like a preceptor that did not want that and was just kind of like, are you even cut out for this? I don't think you are. And then didn't want to teach because she was like, oh, I don't think you're cut out for it.
Wow.
And then kind of just, it's really, in a word, it's bullying, it's hazing. And I think a lot of people would agree that this happens everywhere to new nurses.
I mean, it's interesting because, bullying or hazing, I think, happens, it's behind doors, right? It's never really exposed. And I'm just curious because obviously as a physician and going through medical school, and the stuff that we went through was definitely hazing and definitely there was bullying, but it's just interesting to hear your side of it, even from a nursing side, because it just seems like there's a lot of consistent patterns of when we're, on the low end of the totem pole to the higher end. And it's funny because in medical school, I remember this lecture, this guy said, you guys are medical students and you are at the lowest end of the scum of earth.
Mm-hmm. That's
He's
a nursing
like,
student.
that the fungus that sits at the bottom or at the back of the fridge. He's like, that's you guys.
Mm-hmm.
He's like, there's nurses, and he goes, oh, what are their the techs? They're called
Patient care techs.
patient care techs or
Like a
whatever. He's
CNA.
like, they're like, everyone knows way more than you guys, so you always have to remember that you're as low as it gets.
What was so funny to me too, like as a brand new nurse, like those were the people I went to, as the patient care technicians and the CNAs, like the
Yeah.
MAs. Those were the people because you felt like you could go to them and talk to them. Whereas if you went to another nurse, it was like, why do you not know that?
Yeah.
Are you stupid? Like that's what it was.
So did it ever prevent you from asking a question and you were scared
100%.
to be yelled at in front of everyone?
100%. I didn't want to go to, like, it was a majority of people.
So what would you do if you didn't know something?
I would go to the patient care tech, and it's like, I just went to school all these years, and these are people's lives in my hands, and I'm going to somebody who only has, like, the real life experience, not really the education experience. So
That's sad.
it is sad, but I mean, you couldn't go to them because they would make you feel stupid. They would tell everyone else, oh, she didn't know how to do this. And it's like, well, yeah, I've never done this before. I just started. You're my mentor.
We were taught in medical school from day one, you see one, you do one, and you teach one.
Mm-hmm.
Like that. And so that was like, the mantra throughout those years, but it didn't seem like it ever followed that.
No. And like there was even a nurse educator, and it was like that was the most terrifying person there was.
So I'm going to take a stance. I think that, and I'll give you guys my side of the story too, but did it toughen you up? Because, the question is, you are dealing with everyday multiple patients who are sick, and the stress that it puts on you, because you're still, whether you're day one or, however many years into your profession, you're always going to remember those events that you did not know, or you got yelled at, or there was a situation, because the thought process is, and I don't know if many people agree with it, is you learn from that, right? You learn from mistakes. As long as they're guided mistakes
They
and,
weren't.
and nothing that led to a catastrophic event.
Yeah, nothing ever happened that was catastrophic. I'd never pushed my limits or anything, but I can genuinely say I did not learn anything from the way that they treated me.
So you learned from trial and error.
Yeah. Yeah. And like sometimes if there was a nurse that floated to the unit, like a different kind of like new perspective, I'd ask them even, because I felt more comfortable with a random person than the people who were teaching me.
So then now when you look back and you see, obviously you're way more comfortable and experienced than you were when you were talking about right now.
Mm-hmm.
And let's say you had a day one nursing student. How would you treat them?
Oh, it has made me, I would treat them so well. And I even would have students, like as a new nurse, which is sad, but there's so many new nurses teaching new nurses, blind leading the blind. And, but whatever I knew, I was trying to teach them. But I told them, I was like, don't let anyone make you feel like you can't ask or learn, because how are you going to learn?
So you thought that was a big barrier.
Huge barrier.
And were there people who were treated the same but yet still would speak up?
I mean, depending on their balls, yeah, if they did or not. But I mean, there were times where I would say, look, I've never done it before. You got to tell me step by step. You can't just say, go do it. Like that's not how it's going to work. That's not a good teaching mechanism.
Wow.
But I mean, there would be hazing situations where, like, because when you have a preceptor, you usually
define hazing. What do you mean?
You'd split the workload.
Because we know you're obviously from a sorority in Florida State University, so that is,
I mean,
I'm sure, hazing,
it's
right?
a coined term, yeah.
Yeah. So, but now in this realm of things, hazing, would it be very similar? Because you actually have a comparison, right? Of like what people think out there in a fraternity, sorority hazing versus now the professional life.
I mean, I heard a lot about fraternity hazing, but it never happened in sororities. At least mine, it never happened. But I mean, you knew what it was. You learned it in shows, TV, and stuff. But
now you're in this, and you would actually coin the term hazing.
I would coin the term hazing. I really would. Like, I'd be like, you're left them out by yourself to, like, you're on your own, or.
So, for example, they'd be like, go do this, show me that you did it, do it on your own, and good luck. But yet at the same time, the expectation is that you do it right. And if you don't, then you're looked down upon by your own preceptors or people who are training you.
And then instead
of
teaching. Is that how you felt? Yeah, but even worse, like, when there's a thing, it's like Code Brown, okay?
Okay. I'm assuming it has to do with poop.
A little bit.
Okay.
Yeah. So,
well, if it's Code Brown, it's probably a lot of poop.
Oh, it's a lot. It's a code, It's a Code Brown. So there would be times where, so when you have a preceptor, you kind of split the workload a little bit.
Right.
Because you're right under them. It's two nurses doing the same patients. So sometimes it'd be nice, hey, can you go grab me that? And then it would kind of escalate, like, over time. Once you got more comfortable with things, they would make you do more and more. And so the Code Brown definitely happened all the time, and of course I was tasked with it all the time.
So they let the
new person,
the newbies do it, huh?
It's because they've already done it, and they're tired, and they're burnt out, and they're over it.
Yeah, I can see that.
Yeah, but at some point you got to know, like, the cycle of, like, everyone being burnt out, the cycle of everyone being over their jobs. If you're like that to the people coming in, they're not going to make things better.
You felt that burned you out?
Yeah.
Or that accelerates the burnout pathway?
100%. The people teaching the new people make them hate it quicker, because the people that are teaching them terribly. Makes your life harder.
They're not teaching it in a manner that actually makes you happy to be there and learn it, even though you may be in an ugly situation like a Code Brown.
Yeah.
Which obviously, if you're being treated okay and it's all right, you know what? Get it better than just being told. But it makes the situation better as long as you're being treated, are educated and taught about the process and everything.
Yeah, and I think that it just needs to be known, like, when new nurses come in, like, you don't know if their clinicals when they're in school, if they were able to see a lot of things, or if they're from a small school in a small town and they didn't really get to see anything. I went from a little tiny town where the acuity of the patients was very low, like the severity of their illness was very low, to a level 1 trauma center with quadriplegics, shootings, people missing their skull, like things
Right.
that you never see before, and you're thrown into it. And then if you ask any question, you're laughed at, you're joked about, you're looked down on, you're spoken to like you're dumb. And then you feel like you can't continue to learn because they make you feel like you're stupid.
Did all your colleagues feel like that? Or, I mean, I'm assuming there has to be situations, obviously, where they had a better scenario than what you're talking about.
I mean, some people had some better ones, but they definitely, from the get-go, it is, as a new nurse, so stressful.
Yeah.
You're taking in so much information, and then, oh, you're only training for a couple weeks, then you're on your own.
And then you're dealing with not just the patient, the family,
Mm-hmm.
and then you're dealing with the doctors, and then you're dealing with all the specialists and everyone involved in that patient's care.
Mm-hmm.
So you have to answer to not just your own colleagues who are working with you, but everybody else that deals with that one patient. But then that's only one patient. You guys carry like 5 to 7 or even 8 patients sometimes, right?
I mean, I think the most I ever had was 6,
Okay.
which is wild.
Right.
I feel like I said it like, oh, it was just 6. It's 6 people who are severely ill.
Mm-hmm.
You can't be 6 places at once.
Right.
That's the bottom line.
Right.
And then you have to kind of gauge, who do I see first? Who do I see second? But how do you gauge someone who's, I don't know, a quadriplegic? They can't move any of their limbs. But then I got the crazy schizophrenic over here missing his skull flap, like his whole skull. So if he gets out of bed, he's dead if he falls.
So you triage who you have to manage and,
Yeah.
and see first. Or
Of course. But it's still like, okay, out of the get-go, this wasn't a test question. This was not something I was prepared for. This is, here's a report. You have 6 patients. They are all severely ill, in danger to themselves. Good luck.
So when you were in school, you didn't see obviously maybe a whole category of everything you may have seen at this hospital.
Not at all.
But was the culture in school very similar with how it was when you went in real life?
I think it's just everyone's so stressed out, they can't even help it. Like, they just treat each other so badly because they themselves are struggling so hard. So it's like an endless cycle of making everyone else struggle even harder.
So for people out there who don't know, what is average shift time that nurses carry? Like the hours that
Like
they
how
work in a
long?
day? Yeah.
So you
Is it 7 to 7 or?
yeah, you only work the 3 days a week, but you get there probably around like 6:20.
Mm-hmm.
I probably
In the
clocked
morning.
Yeah, 6:20 in the morning. Go in, you get on the computer, you look at all your patients who you have. You got to research everything about them.
Right.
These people's lives are here. If you don't know, are they allergic to this? Or
Right.
are they on blood thinners? Like, do they have a DNR? That's very important.
Mm-hmm.
Or do they have a surgery that day?
And a DNR for everyone out there is a do not resuscitate order.
Yes.
If something were to happen to them, you would need to know
Yes.
immediately.
And sometimes you'd come in and somebody would be 99 years old and they'd be a full code. And
Mhm.
you need to know that because
Right.
that patient.
There's no assumption.
Exactly. There's no assumption if any day now. And it was just, so you start off like that. You get all your patients. It's like 6:30. You have a little huddle meeting. And then you'll go door to door learning about your patients, trying to kind of gather as much as you can. Then you go and you start your day. You got to figure out who you're going to see first. And then it goes from there. And there's so many things that can happen from there. No day is the same. And then you probably end your day. Fast forward. I mean, you don't eat, you don't drink, you don't sit down. Like,
And I'm assuming when you snack, they're just unhealthy snacks. I remember there's
they're
donuts at the
terrible.
stations. I
you
bought
bring us
donuts. I
donuts,
know.
yeah.
But it's easy, quick, and something you just
grabs.
grab and it fills you up for that temporary moment.
Oh, yeah. And then ACA or OSHA, whatever. You can't have water
Yeah.
around you.
Yeah.
Like, it's not an office where
Right.
you
There's
can,
a lot of guidelines and rules that you have to follow.
Mhm.
That prohibits you guys from having access because you have such a difficult day. And
I remember my watch would be like, you stood 16 hours today. And I was like, oh, awesome. But,
how many steps did you put in?
oh, miles. Back and forth. And then I'd hurt my back. And it was a mess. But, like, you can't even have water. So your water, where it has to be in a certain place, it's far away. You can't even walk over there. You don't have time.
Yeah.
So they call it a nurse hangover. Like, after a shift, your next day you're hungover because you're dehydrated.
Right.
You're basically ill from your shift.
You have to reset your body.
So yeah, you work 3 days a week, but the days after you work, you're kind of like, let me calm down a second.
Yeah. So hindsight 2020, you look back, did it make you a stronger person who you are today?
Oh yeah, I can't even think about doing that right now. I don't know if I
But
could.
it made you a stronger person, right?
It definitely
And you
did.
felt like, did it make you a better nurse?
Oh, well, what?
And there's many ways to look at that, right? Did it make you a better nurse that the comfort level of what your knowledge that you gained, you kind of got thrown into it? So now your
yeah.
confidence level changes, right? Won't you think so? Won't you think that maybe, hey, we're dealing with life here? Obviously, you got thrown into these little situations or are big situations, but life was never compromised. But yet you felt like you're almost learning that bell curve. Like you got it, and now you're a stronger
It was
person.
a good feeling once I finally came in and felt good. Then felt comfortable doing it. It took a long time.
So sometimes those TV shows are right. You look at Grey's Anatomy, where we used to call it scut work, right? It's called scut work, where you go in and you do what we think is BS work, but it's busy and it's probably disgusting, or it's something that is not appealing that you really want to do. But yet scut work was for people who are, as I said, lower on the totem pole. But yet you look back and you're like just on TV. You see
I don't know.
you accomplish it and there's a smile on your face. Like, yeah, I did it.
I just can't tell if the way that I was brought up made me stronger, or if now I'm just strong because it took longer. I really, looking back, I wish it would have been different still. I wish I was trained different. I wish I was brought up differently. I mean, I ended up having to do a lot of it on my own, but I don't know if that made me stronger. I think I could have been stronger if I was taught better.
Well, in a way, it probably made you stronger. So when you do have a nursing student if you ever do, obviously you're not really much clinical anymore. But if you do, then your knowledge base of what you learned and how you were treated, you would approach it differently.
Mm-hmm. I think now, just because this particular place and unit, they've had so much turnover, so many people leaving. So, going.
Well, you've seen other units too, and you've had exposure to the ER. You've had
Mm-hmm.
exposure to children's hospitals in the past and stuff like that. So you've seen a wide variety of units as well, right?
Yeah.
But the biggest question is it a medical culture problem, or is it something that we inherently just walk into and it's an expectation because it's like,
I did it.
throwing the
Now
word
you gotta do
hazing
it.
or
But that's hazing. I had to go through it. Now you have to go through it. But it's
Right.
the term burnout has been here since the 1970s.
Mm-hmm.
Why are we still having it?
So you strongly believe that the medical culture and what you went through leads to a higher burnout turnover.
I think that's maybe why I went through it that way, is because they were burnt out. And because maybe they were like, well, we've had to do all of this.
Mm-hmm.
If this is hard for you, you got to go.
I'm just trying to think from when I was in training, obviously you work long hours. Everyone works long hours when you're in that type of situation. So,
oh yeah, I didn't even
by
say when I go
default.
home.
Yeah, what happened when you go home?
I probably would leave the hospital 7:45, 8 p.m. So it's really like a 14-hour day.
Mm-hmm.
But yeah, that's when I go home.
And you eat actually, or you just lay in bed and pass out?
No, when I get home, I feel sick, and then I'd maybe snack on something and pass out.
That sounds healthy.
Well, then when you do 3 in a row, you have to go to sleep. Don't
Yeah.
have that much time to waste.
3 in a row, back to back to back?
Oh yeah, I did that all the time because I wouldn't want to go any other days. I didn't want to look forward to another day, so I would just knock them out.
That sounds like that would lead to burnout.
A little bit.
But I'm assuming a lot of people do it too, right? And are not, maybe it's an accustomed to, they've adapted to this type of lifestyle.
I mean, I did get used to it. You get used to the 12-hour, 14-hour day.
Because I think a lot of people, they say, so how's the medical profession? And a lot of us answer, it's not really a profession, it's a lifestyle.
It is a lifestyle.
So people don't really understand that, right? Like our significant others, or just maybe the general public. And I think COVID exposed some of that, of how hard or what people do inside these walls. But
I feel like COVID is people see trauma every day. This is what the nurses and the healthcare heroes and the doctors, they see trauma every day. But I feel like the silent trauma is every day. You have to have, even if your patient isn't actively dying,
right,
or you don't have a trauma alert coming in, you still every day are watching people who have no life. their quality of life is gone.
Yeah.
And you just sit and watch their own family members have no quality of life every day.
So there's a big emotional and psychological component to this too.
Oh my God. I
Did
was
it change you
messed up.
emotionally and psychologically?
Oh, it messed me up.
What did it do?
A lot of things. I was messed up. Like you would think about one patient or one family member days after you even had them. But like the fact that you would just watch the tiny little traumas that built up all the time, it just wasn't normal. I was 22, 23, and I was seeing just people with just no quality of life.
But did it change your perspective in life?
Made me want to be a DNR
Okay.
some days.
But even with your family and friends and everyone, did it they say, yeah, this is kind of changing you. You're like a different person now.
They're like, you're like sad. Like you seem depressed.
I mean, there has to be happier moments too, right?
There's little silver linings in it.
Okay.
When you see the
and
ones.
do those add up to?
No. Definitely more negatives than positives, for sure.
Okay.
I think a lot of nurses would agree.
So, but I feel like if I go get 10 people, put them in a lineup of nursing students, I feel like I'd also get opposing point of views of saying, you know, my experience was different and my first day of work was this or that. I mean, you would have to agree there would be probably opposing point of views.
Oh, their journey, yeah, definitely opposing views. But, I mean, what they see day to day, unless they're in a very healthy hospital and they have patients there that don't need to be there.
Right.
There's no way.
Of course, we're dealing with sick people who we don't know if they're going to make it. And you have families and you're seeing how the families and receiving bad news are every day, every hour, not knowing until this lab result comes back or pathology. Is it cancer? Is it not cancer? I mean, and imagine having multiple of those patients at the same time. I just don't think
people realize it was so funny. They'd say, what's a nurse? And it was like, it's a secretary, it's housekeeping, it's a therapist, it's maintenance, we're bodybuilders.
Believe it or not, we tell patients, families as doctors that the nurses know the patients a lot more and their eyes are on these patients all day, every day.
Yeah, we're the ones there.
So you guys are the front, literally the front line of knowing what's going on, because if something bad is happening, then we get alerted by you guys, right? So it's important also to maintain, that.
Do you think it's ever weird that the role of a nurse and a role of a doctor and the schooling of a doctor and school of a nurse, like the role of the nurse being there at all times, they're the first ones there if there's an emergency. They're the ones physically administering things.
Well, I'll be honest with you. I do think you know this very well, that when we know there's certain nurses and patients, whether they may be new or seasoned nurses, doctors also have preferences sometimes on which nurses are on their patients as well. Because there are nurses who are able to identify a situation before something bad happens, not when it's happening. So they know the appropriate timing, how to call, page, notify us.
Isn't it kind of scary though? Like you're relying on someone who has less education than you to notify you.
I mean, yeah. I mean, it's. I think everything is scary, right?
Yeah.
But at the same time, you have to have. I do think nurses do have that knowledge and ability to be able to identify things on patients, right? Simple things, vital signs, or the blood pressure starting to, come down. There's a trend, right? And then are they not eating? They look different compared to yesterday, because I had this patient all day yesterday and today, completely different person. So those are a lot of cues that you guys are able to identify. That makes a huge difference. And I don't know if that comes with training. I think that comes with just understanding and knowing how to communicate well and how to not be afraid to call a doctor or page a doctor and just knowing your environment. Even family members that sit in a room, I think that's very important to them identifying. They know their loved ones better than any one of us.
Oh, yeah. I just went through my grandmother in the hospital, and if she didn't have family, I don't know if she'd still be here.
Right.
Honestly.
Yeah, and that's what I mean. There are, and of course, whether they have family or no family, but I think nurses are really, anyone in this profession, medical profession, a whole umbrella, I think we're taught that finding and identifying and knowing when something's not right. And that's why I believe, obviously it's experience, but it's also on who trains you, who's your preceptor, and someone like, maybe a physician telling nurses, look, this is how I think it should be. This is what I see. Good job, good compliment. Because you got complimented whenever,
Oh yeah.
hey, good. It was great. You saw this lab and you notified and So obviously there is feedback. Whether we
I
think
mean,
it's direct feedback or indirect feedback, you're still getting forms of feedback.
because I feel like I'm sounding like I was a bad nurse. I was a good nurse. It just took me a lot longer to train myself because I had to train myself. And then
Yeah.
I was a good nurse. But I mean, it's scary. It's a scary thing.
I mean, I can relate. I mean, it's obviously medical school and then residency. It's very, very similar.
Mm.
I think to some extent, I think it's definitely some of the things that we have to go through. I mean, I personally, when I was a first year, I was an intern, and I remember I was rounding in the CCU, and I pulled a 48-hour shift. I was the main um, physician on for this major hospital. For anyone that was not doing well in the course of the night, we'd get the first page. So we would be there with the rapid response team. We'd be running the code blues for people who are obviously, are
Code blue, no pulse. Their
no
heart
pulse, they're
has
not
stopped.
breathing, and we're intubating. We're throwing in these important lines so we could give them immediate medicine to them so that hopefully we restore their heartbeat and everything else. So, anyways, those nights you would always see something crazy and multiple sometimes. So,
Speaking of, my second day had a
yeah.
code blue. Second day.
Actually, I think I do remember Code Blue
I
around
hit the
that time.
button. It's the only time I've touched the button, only time I ever want to ever hit the button
You
again.
started CPR?
No, there was another doctor in the room. I felt
Oh.
really bad for her though. She was a tiny little lady, tinier than me. I'm like 5'3", 113. Like
I mean, it's usually what happens, right?
she was tiny, but she
Yeah.
hopped right on. She straddled him, started going,
Huh.
and then we found a male nurse in the in the hallway. But
Yeah. I mean, it happens, right?
it happens.
I can tell you right now that when I was rounding in a CCU, didn't sleep 48 hours. We had a team. We had a pharmacy team. There's medical students. There's residents at different year levels. I had my own seniors there. And of course, there's what we call the attending. So the attending is what they do. They pimp you. We call it like they pimp, meaning they ask you a lot of questions.
Oh, they test you.
And they love to ask questions because it shows, A, have you read up on it? Have you seen it? Do you know about it?
Are you
Because if you
prepared?
don't, I expect you to. So I got probably for 20 minutes on one patient, I got asked a question about this drug and why this one drug was administered and not these other drugs. And I got reamed. And when I mean reamed, I got he was throwing stuff and everything. And of course, there may be some professionalism, but that to me felt normal situation. Like it didn't feel like it was abnormal because it's what I was used to either seeing or experiencing in my own training. So I'll never forget that, but I'll never forget the question, the answer, and the right answer at the same time from that moment. So
You'll be prepared now.
So I think that, obviously medical, I guess you want to call it bullying or medical hazing or whatever you want to call it truly exists. But, I don't know.
I think
I've never
some
done
forms
that.
could be positive, medical hazing in a way.
I think it's important for people to be thrown into a situation and use your knowledge base, as long as it's a safe and secure means of doing so and it doesn't affect a patient or anyone else's life, so to speak. But I think there's positive outcomes that come out of it because, like I said, you'll never forget certain incidents where you got thrown into and you were forced to come up with answers or do something.
It was just funny because day 2 I get that code blue, but day 1 you're learning about all the emergent buttons and everything, and they're like, never touch that button. And I was like, okay, but when do you actually touch the button? She goes, well, when they have no pulse. And the thing was, like, I didn't even like put it up to question. Like he could have maybe had a pulse, but I wasn't even hesitating. I was like, I don't want to even question this. He did not have a pulse, but I hit it.
That's the right thing to do.
Yeah, I hit it
If you
quick.
have any question at all, you just hit it.
I just hit it.
And within seconds, you have at least 5-10 people showing up.
Do you know, okay, a lot of people saved that man's life because he did end up surviving.
Mm-hmm.
But the first person that called us in the room was a patient care technician because she couldn't get a temperature on him because he was cold. But couldn't get a temp. And so she called me in. And of course, I'm like, that's weird. Like I didn't at the time even
Right.
think twice. But I was like, maybe it's the thermometer. Maybe it's the
Right.
machine. Now it's like if any of the techs can't get a thermometer or like get a
Obviously, yeah, you
temperature.
learn obviously
Yeah.
by assessing a patient, not even having to touch them, but just looking at them and knowing something's not right. So,
Yeah.
I mean, that's what you did. You pushed the button and, it worked that day, right?
Kind of crazy too, because myself and another nurse, we had him 2 days in a row. So the day before, like we both were just kind of like, he's too sick for this floor. He needs to go to an ICU.
Yeah.
Like from the get go, coming from the ICU, we're like, he's sick,
Right.
and he's like declining.
Right.
And then the next day, there you go. I was like, we had an inclination, but we didn't really
Right.
step up that much to it.
Well,
We asked for him to get moved up, and they're like, he doesn't meet the criteria.
right. Well, which is true.
Which
Unfortunately,
he might not have.
there's criterias that are met, and there's so many sick people, especially in one hospital, that they each have to have a bed who meets the criteria. So,
And when he didn't meet the criteria, we were like, okay, what else can we call on him so we could just find everything we can about him? So we were
Yeah.
like, he might have sepsis. So we got a whole sepsis.
well, see,
sepsis stuff.
that's how you look at the whole, nursing and eyes on these patients and identifying a patient's not doing well, and then you guys notify the doctors, and then
Yeah.
one thing leads to the other.
I mean, that was definitely an eye opener on day 2 as well. Day
Yeah.
2 alone, not day 2 as a student. Like you have your preceptor with you.
Right.
Like day 2.
Yeah.
Scary times.
Yeah. But I don't know. I mean, I see, obviously, I hold a middle ground perspective on this, I would say. I don't think treating is subordinate, so to speak, is like in a bad way is a good thing.
Mm-hmm.
But at the same time, I like to challenge people.
Mm-hmm.
So when they ask a question, my first response is look it up.
I just think what's really hard is the insubordinate thing in teaching. I think there's not really a lot of teaching on teaching.
Yeah, I think our world was, if we didn't know something, we would be sure to look it up.
Yeah, you had
Because
to.
once you do look it up, because you could give answers to someone all the time. Does it always stick? No. Once you look it up yourself, then that adds a whole nother dimension on your learning and how you comprehend and how it sticks with you in the future.
I mean, that's just another thing. I know I brought it up already, but it really is blind leading the blind. It's all new nurses nowadays.
Yeah.
Like at a lot of level 1 trauma centers, it is the majority
A lot of any hospitals.
are new nurses.
Yeah.
And then when a new nurse comes in, they're getting taught by another new nurse that was half-ass taught.
Right.
It's scary. And that's who has your family.
Well, I mean, that leads to a topic which I'm sure we have in future episodes or doses of, shortage and staffing issues.
Oh, yeah.
Because we all know that COVID did play a role significantly in imbalancing the perfection of how hospitals were staffed with nurses, and they all went and did their own thing for travel, and of course that affected the entire situation.
Here's my question for you. Why do you think there's such a shortage of nurses? Just an opinion.
Well, I mean, number one reason, personally for me, I believe that COVID really caused that to happen. I think people saw money that was being paid better at different places for travel nurses, which led to really, really good nurses who hospitals knew and trusted, and now they lost them because they left for a better payday.
Mm-hmm.
And I think that also the medical field and the schooling and everything has changed all due to that. People are not wanting to go into these type of fields more. There's technology, there's people working at home, there's better situations that now has completely caused a paradigm shift in the profession. And I think that really is playing a big role. I mean, imagine just working. You still have the knowledge base, but you're working from home and you're on your laptop. And, you control your situation. You're not being yelled at or anything else. Who's not going to want to take that? But yet, yeah, and you're making more money on top of that.
Yeah.
So it's almost goes along the line with, I believe nurses and teachers should always be paid way above, because those are very important people that, they're teaching our young ones, and you have nurses who are keeping us alive. That's for me, I think that's a big issue that needs to be looked at, and how the pay scale is, and trying to stop these other big companies from stealing, really good nurses who belong where they really belong in their own community and helping their own people.
I mean, I definitely know. I see people leaving left and right. Why
Yeah.
would they? Why would they stay somewhere
I
that
think also nurses go for better opportunities to increase their education, which includes becoming a nurse practitioner as well.
Mm.
So I think that field
I feel like
has
that might
really.
be on the low end of why people leave, though.
You do?
Because it takes a long time to become a nurse practitioner, and it takes means to be able to be one. Like, you have to have the money to
There's
fund it.
so many nurse practitioner schools out there, though. There's a lot of different schools out there that really
If you would
could
have
take
asked
advantage
me,
of it.
but if you would have asked me a year ago to become a nurse practitioner, I would have said no.
Well, I could see that. I mean,
Because
obviously,
working as a nurse
right.
makes you not want to do anything more into healthcare. It makes you want to do less.
Well, at the same time, you could look at it that I'm on the inside of this, in the patient's room, dealing with a code brown. Why can I not be a nurse practitioner who is now giving orders to that nurse or vice versa and be that person, that provider?
That's true.
So I think people look at that as the golden parachute
Mm-hmm.
of opportunity that I'm cleaning up poop. Why am I not a nurse practitioner who is just like any other provider and trained, able to give orders as a, situation where I'm not cleaning up poop?
And I'll
Right?
bring up, too, how scary the travel nursing was, honestly.
Well, did you do travel nursing?
No, how scary working alongside a travel nurse was.
Oh, yeah.
They-
I dealt with that too.
Do you know how
Yeah.
easy it is for them to lie to these travel companies? And then the hospital is a contract or hiring through a company.
Right.
It's like a, telephone game?
Well, I felt like their knowledge base was not there, and they were there just to pass time, so that they could take their $150 an hour.
Crazy. They didn't want to work as hard,
salary.
that's for sure.
No, I thought they were not as effective as the ones
And they're not really working for the hospital. They're still working for their company. So it's like, is someone from their company managing them? No, not really.
I think a lot of people profited from this, and COVID
Yeah.
really exposed this situation and caused probably not just a present situation at that time, but a future problem. And we're going into this years down the road, probably experiencing the same issues.
Yeah.
And the concerning part will be what's going to happen when there may be more than just COVID or something else.
Oh my God, don't even say that.
I mean, you have to think
we
about it,
can't
right?
have any more epidemics or pandemics. We're done with that.
Yeah. I mean, we are done for now. But at the same time, let's learn from the lessons that were created during this last pandemic.
I will bring up too, just to touch on it, a nurse, like the stigma of nurses and the stigma of doctors.
Mm-hmm.
When you hear doctor, you think big ego, you think big head, you think bossy, you think, you think usually negative things first. And then, of course, they save lives. They are the reason why people are alive today.
Mm-hmm.
And then you could go to nurses. The stigma of nurses is, okay, I'll say it. A lot of people say if you're a nurse, you're usually bitchy. Or if you're a nurse, you're playing solitaire at the nurse's station. Or
Right.
There's a lot of stigmas out there. And it's crazy seeing it at both of us from the other ends. And it's very, very different.
Well, it's almost like you wish that when you're in school and you have shadow a profession that you want to become. I wish they did that more often because people need to see the behind the scenes stuff that really happens.
Because everyone does think that nurses are rude and lazy and clean up poop. That's not what we do.
Right.
That is far from it. Yeah,
You've had a lot of bad luck with people talking to you about how nurses are, huh?
Oh, well, if you just go on social media, Instagram, TikTok, Twitter,
you don't think, though, that
that's what they say.
first response heroes, again, I hate bringing up COVID, but a lot of people really supported
Maybe
the nursing
during that
profession,
time.
right?
During that time. I don't think they're having that same support now. Because the staffing ratios and everything is way worse than COVID now, like the ripple effect from it.
But I'm saying the stigma of, like, quote, the bitchy or the, persona
No,
or,
you still get
or the adjectives that you're saying people use.
You'll get it. You'll still get it. It's on all social medias, even dating apps and stuff. Like if you're a nurse on a dating app, the amount of comments that
Really?
you get.
Wow.
Yes.
So you're saying
Pro
you don't
tip.
feel it's a respected
No, I don't think nurses are
profession.
respected at all. I think healthcare heroes and what they do, some people have respect for them for sure, but when you hear everyone talking about it, the way that you're actually treated day to day as a nurse, you do not feel like a healthcare hero, and people don't make you feel like one either.
Yeah.
So I
That's
would say
sad.
no. Of course, like my friends and family, they respect it, and there's so
Right.
many people that respect them, but there's still so much negative out there.
Yeah.
Negative treatment, just negative views. Hopefully over time they'll be more and more respected, but it's still not there.
I mean, of course, I see what you're saying, and I I didn't really realize it was that extreme. But at the same time, I think that in my lens, I felt like sometimes that a lot more respect came from this too.
You were a
But
outlier though. You respected
no, I know
nurses so
physicians are like
much.
that though. But I feel like we're all in this together.
Yeah, team.
And it's like, and when you're in this together, like in a hospital or a workplace, like I think everyone's mindset changes and attitude and feelings and everything because no one else experiences what we experience, right?
Well, it was
So
all hands on deck.
yeah, no, and I mean again, I think COVID exposed it, but I feel like what I'm trying to say, this probably got manifested through that, that respect because everyone did it, and I mean, we all saw, a patient dies. It's not on the nurse. It's not on the doctor. It's on the whole team, the whole
Yeah.
medical team.
Mhm.
Like we all feel it, right?
And
I
of
have
course
doctors.
I'm generalizing.
Yeah, no,
But
I get it.
but yes. Because I am generalizing, but there is a lot of truth behind it. But I mean, even the doctors, y'all get a bad rap too, and that's not fair either.
No, that I already know.
Yeah, but it's not fair. You were like one of the most respectful doctors that respected nurses just as much. So
Right. Well, I mean, I think it's also like you said, we've all been through our phases of training and how things are, but yet we define how we want to be when we are in that situation to teach people and maybe make them aware of hey, maybe this is a better way of doing it, and the professionalism that comes out of it. I think, that's important because from obviously clearly from this podcast and this episode or dose, there's a lot of negativity out there, and hopefully, like we can find ways to change it.
yeah, we got enough on our plate. We don't need any more. Doctors, nurses, all healthcare workers, they got truly enough going on.
Yeah, 100%. So I'm sure with everything that we talked about, once we'll hear feedback and everything, that opinions are gonna come at us and everything. But the fact is that we brought up a lot of reality of what happens when you're in this profession, and hopefully this brings out some meaningful discussions and situations of improvement as well.
Yeah, like I hope it brings agreements and I hope it brings disagreements because at the end of the day, the more thoughts on it, the better.
Yeah, I agree. Well, it's been great, and looking forward to the next one.
Yeah, thanks for listening to our second opinion.
Have a good day, guys.